Welcome back to 20 Clinical Pearls in 20 Days. Today, don't give your patients selenium asterisks. Yesterday, we talked about why selenium supplementation doesn't improve T4 to T3 conversion. I showed you the receipts. I showed you the papers on this. Now, why don't you want to give patients selenium, extra selenium? Because it seems that selenium supplementation might cause insulin resistance and or type 2 diabetes. That's not preventative medicine if you're causing somebody something by giving them a supplement. Well, this paper, for example, said that both selenium deficiency and excess leads to insulin resistance and beta cell dysfunction. Here's a paper that said that when selenium is above the recommended dose, it causes both hyperglycemia and hyperinsulinemia. And in this paper, they give 1,200 people about 200 micrograms a day, and after an average of 7.7 years of follow-up, found that, and here's what they said, don't give selenium to prevent type 2 diabetes, and in contrast, long-term dietary supplementation with selenium may increase the risk for the disease. This review paper basically said the same thing. Until proven otherwise, selenium should not be given in order to prevent type 2 diabetes, especially in the U.S. population. Now, why would they say U.S. population? Well, that's the asterisk. Who should take selenium? First of all, you have to know where you are. Average intake of different countries around the world have vastly different intakes of selenium. Venezuela, Canada, Japan, the U.S., maybe Australia seem to do pretty well when it comes to selenium intake, especially when it comes to glutathione peroxidase activity and or selenoprotein saturation, although less fit that one. We can also look at plasma levels. The optimal plasma level, according to a number of studies, is around the neighborhood of maybe 110 to 120, maybe 122 nanograms per milliliter or micrograms per liter. And you can see that a number of countries don't even measure up to that. So number one is know where you are. Number two is test it, measure selenium. If that weren't enough, here's one more reason. Here's a study that was a randomized control trial giving 300 micrograms of selenium and said that taken for 5 years in a country with moderately low selenium had an increased all-cause mortality 10 years later. There are a whole bunch of stories, myths, misconceptions, watered-down concepts taught in the functional and nutritional medicine industry, and selenium is one of them, which is why we have over 200 hours to help nutritional and functional medicine practitioners practice better medicine more successfully, more confidently, and get better patient outcomes. Join us at metabolicfitnesspro.com. Take a look at our advanced mentorship program, apply, book a call. We look forward to seeing you there, and God bless.